Hi, I'm Alexandra Harrison of Supporting Child Caregivers. Supporting Child Caregivers is a nonprofit organization that offers helpful information to parents and to other child caregivers across the world. I would like to talk to you about pregnancy and caring for a new baby in the time of the COVID. Pregnancy and childbirth are wonderful, but they're challenging even in the best of times. And now, in the time of the coronavirus, they can seem overwhelming. So we at Supporting Child Caregivers understand some of the worries you might have, and we have some ideas that might make it easier for you. What are some of the worries? Well, people worry that their daily routine will be disrupted by the travel restrictions, and it may make it harder for them to go to the market to buy food, or to the pharmacy, or even to get out to see friends and neighbors and family. All these activities can be interrupted. Also, when you have a new baby, it's even harder to get out of the house. What if you have no one to take care of the baby, and you need to get to the pharmacy to buy formula, or to get medicine for you or for the baby? You might also worry that when it's time to give birth, that the midwife might have trouble getting to your house. Or if you plan to go to the hospital to have your baby, you might worry that it will be hard for you to get there in time. People also worry sometimes that there's disease in the hospital these days, and you or your baby might get infected. And if that happens, you might worry that you'll be separated from the baby, and that might interfere with the bonding. Also, people are afraid these days that their family will not be able to be with them when they give birth. All of these are important worries. Without your family, after the baby is born, you might be afraid of being alone with your newborn, especially if this is your first baby. You might feel isolated. It's very hard to maintain supportive connections with people during this time of social isolation. In addition, sometimes people in your family give you problems, even big problems, and these problems can get worse when everyone is under greater stress. You may find yourself feeling that the anticipated joyful birth you had been wishing for, dreaming of, has been taken away from you, and you may be left with a sense of loss and even dreading the childbirth. Well, we have some ideas that might make things easier. The first is to do everything you can ahead of time. Talk to the nurse or doctor or midwife about where it is safe to give birth and what you can do to try to make things as safe as possible for you and your baby. If you anticipate these problems, then you will feel more relaxed when you're prepared, of course, as much as possible. And also, we would like you to try to take care of yourself, to sleep and eat well, and to have gentle exercise, to take a bath, to do activities that you enjoy, and really to stay connected with families and friends remotely, of course, these days. But the most important thing is to search for, to find supportive people, because that's what you will need the most. These may be your partner or your family or friends or anybody really. You want to talk to them about what you need and tell them the questions you have about how best to prepare for the baby or how best to care for the baby once the baby comes. Ask them if you can rely on them to help in case of emergency. People can help you in different ways. There will be some people who are best at doing errands for you. other people who will be able to take care of the baby when the baby comes. Find out which ones can help you when you need to confide in somebody about your worries, and which people give good advice. You want people who will listen to your feelings without judging you. And you want people who will give you their opinions when you ask for them, but won't when you don't ask for them. These people that you find, whether they're family or friends, they will become part of the memories that you will cherish from this special time of your life. When you know that there are people who are thinking about you and people that are ready to help, you will begin to feel safe. And that is good for you and good for your baby.